All right, we're gonna get started because I know everybody has been incredibly busy, so I really appreciate you all coming here today. Last side event of the day. So my name is Marie Nougier. I'm the head of research and communications at the International Drug Policy Consortium. But I'm here representing the core group of the EU Civil Society Forum on Drugs. So for those who don't know, the Civil Society Forum on Drugs is actually the expert group of the European Commission that focuses on drugs issues. So it's basically the official civil society engagement mechanism with EU institutions on drugs issues. So we are a broad group of NGOs, about 42, 43 members now, just got renewed last year. And we come together to try and influence EU drug policies, to have a voice in the discussions, and to be able to bring the voice of civil society in the debate. And internationally as well. So we've got one of our working groups is focusing on international engagement. In particular the CND. So that's why we wanted to organize this side event today on civil society space, drawing from the EU experience, but also looking at how that could influence other processes at the UN, but also in other countries. So the reason why we wanted to organize an event on civil society space is because we're facing, I guess, a moment of crisis. It's with the funding cuts and also the rise in authoritarianism of far-right parties, civil society space is really shrinking all over in Europe, elsewhere. But there's also time for hope. So we have made progress as civil society in bringing our voices to the discussion on drug policy, and we wanted to celebrate that and to share the experience from civil society, but also the experience from governmental institutions and European institutions on how they've actually collaborated with civil society in the past. So we've got a really awesome panel, and I know it looks quite impressive. It looks like we have more panelists than speakers, but their interventions will be brief. And hopefully that will give you a bit of an idea of the kind of work that we've done together in the past. So the first panelist that I have with me today is Artur. So Artur is from the EU Presidency, the Polish Presidency, and he has been very, very amazing at supporting civil society, the Civil Society Forum on Drugs in particular, over the past few months, in particular around the CND. So thanks so much, Artur, for being here, for co-sponsoring the side event, and you have that one.
Yeah, thank you, Madam Chair. First of all, thank you for inviting me to have like some opening speech in this side event. I am deeply honored to take part in this event and talk to you because one of the priorities of the Polish Presidency of Council of the European Union is promote proven and effective prevention measures based on scientific evidence. To this end, it's necessary to build broad cooperation between various entities involved in demand reduction activities. In Poland, an important partner in our activities are non-governmental organizations that deal with prevention measures, as well as assistance to addicted people. As representative of the Ministry of Health Agency, I would like to emphasize the importance of cooperation with civil society in building an effective drug demand reduction measures. The support of NGOs organizations allow us to create a wide range of prevention, treatment, harm reduction, and post-rehabilitation offers in Poland. As I mentioned earlier, one of the key elements of the system of controlling the drug problems in Poland is the activities on NGOs. This is why for many years we have been financially supporting NGOs. We meet with NGOs annually and the national conferences of harm reduction programs organized by us. NGOs are also involved in Polish work on international forums. Before each CND session, we hold coordination meeting with our NGOs and take into account at least some of the expectation in our national speech. During this 68th session, what Marie mentioned, we also organized a meeting with Civil Society Forum on Drugs as a part of the work of Polish Presidency. We're still counting on your support during our Polish Presidency. I can say this like the co-chair of ADG Group. Thank you very much.
Thank you so much, Artur. just to say, I think, and to the honor of the Polish presidency as well, it is the very first time that the European Union is including a civil society representative in its delegation, and the European Commission has also funded 2 civil society members of the CSFD to come to this CND. So it's really a very important example of how to engage civil society in these debates. So thank you. And let me move on now to Ganna. So Ganna Dovbakh is the director of the Eurasian Harm Reduction Association. I mentioned earlier about the issues we're facing in terms of civil society space. Ganna has done a lot of work around documenting what's happening, in particular in Eastern Europe and Central Asia. And so we thought it would be important to start this side event with what are we facing right now, and why are we even talking about this at moments where it looks like civil society is vibrant and we're doing better and better, but actually we're facing so many threats. So we just wanted to put this in context. And so Ganna, you've got the floor. Welcome.
It's not my presentation, but never mind.
Next one, here. This should be
Let's try to find the presentation. Sorry for this, and I need to say that I'm very honored to be elected as a Civil Society Forum on Drugs chair from December, but now I will not speak as a chair. So my view will be not so balanced as it should be in Civil Society Forum on Drugs. We always do this, but with a bit more focus on the Eastern Europe and Central Asia, where we are working. And this is for us really important part of the story. And you could see not only Eurasian Harm Reduction Association logo, but logos of our partners in the Rise and Decriminalize movement. And this movement we started a couple of years ago to understand what are the essence of the stigma and discrimination of different communities: sex workers, LGBT, women living with HIV, people living with HIV, and people using drugs. But now, and the next slide will show you that now we are not working with the decriminalizing of behavior and way of living, not working on depenalization or decriminalization of law enforcement practices and all of these regulations, which we thought had in mind. But now we're working on this background, because what we see in our region, that a lot of states start criminalizing activism as it is, unfortunately. Next slide will bring you the mechanism, and it's in the countries where more or less controlled by Russian politics in this way or another, they're using the same mechanism, and it's not occasional initiative of some populists. It is absolutely clear mechanism to control and to demolish all the free media, all the independent civil society. And in this work, we are not only connected with key populations or marginalized group, we are under the same threat as investigative journalists, organizations working for participatory approach in elections. And this solidarity we see in Georgia, for example, they're fighting all together, and I will come back to this. So how the mechanism is working, that was taken from the Russian example, but in different modulations, states are learning from each other. So there are some barriers to NGO registration, some boards, censorship, you could not register, then you are put it on some surveillance interference, and in some case, if you are protesting, then it will be calls to you, or we know where your kid is going in school, and all of this up to this, and there could be some groups of unofficially paid like hooligans who will come to your events, and we faced it a lot for LGBT events in a lot of countries. And then this law on foreign agent, if you are receiving funding from international agencies, then first you will be just in the list. Then you need to report a bit more than the usual NGO. Then it appears that when you are a foreign agent, you could not be in the consultative bodies to the governmental structures or ministries, and you could not receive the domestic funding. So you are excluded from the civil society world just for using the international forces to survive and to make the advocacy and to make the services in the moment when none of the states in our region supporting advocacy work for community groups and civil society. Then there could be less of access to information. Why? Because if you will say that any harm reduction information is propaganda of drugs, or any positive and neutral language on LGBT life, it's propaganda of homosexuality, then of course, all websites containing the health information, public health information for these communities will disappear. And they already disappeared. And if to speak about harm reduction information, you will find it in our webpage, but we are based in Lithuania. A lot of Russian-speaking products developed in Russia, Belarus, or Kazakhstan, they already disappeared from internet. And then there could be criminal punishment in Russia. They have this list of undesirable organizations. We are not yet in, and we are all time waiting because there are public announcement that we can be there. Not all countries introducing it, but we could expect that it could happen. And there are a lot of the real criminalizing actions going on, and a lot of initiatives starting in different countries against the civil society activists. Sometimes people recognize how criminalized drug use is from the human rights activists when they found drugs in their pocket footed by the police, and only then they recognize how criminal, how harsh the drug law we have in the country. So next slide. Could we just the next slide? Maybe something will be there. So that's actually some additional descriptions from the different processes we see in the different countries. And what I needed to highlight is that if you are a foreign agent or civil society with the international funding, you could not get the domestic funding. And nowadays, we all know that the international development funding from USA and from majority of European countries is facing tremendous cuts. So it will mean that activists need to do their expertise and work and contribution and participation in their free time. And to be on the safe side, you could not spend as volunteer more than 2 or 3 hours per week. So next slide. And we were trying to make the map where it's very severe and where it's burning situation and some initiative, as Yulia Georgieva said, like in Bulgaria, it's already 6th time when they put this foreign agent law in the parliament. So it's trying and trying. And unfortunately, this situation more and more affects European countries, EU member states. That's very, very worrying signals. And with the states we are pointed, it's not only about Russia and Belarus, it's also about Turkmenistan. We've forgotten that there are no civil society at all. Uzbekistan with very restrict, Azerbaijan with a lot of human rights activists still are in prison. Next slide. Next 2 slides will be on Sakartvelo, Georgia. Self-name is Sakartvelo, and that's why we're using in Lithuania, even formally, using this new other name of the country. One of, like, there is, now it's more than 100 days of the protest, nights of the protest. Every night people are coming to the protest. Some actions, mainly this, they called Russian law on the foreign agent, which will ban all the organizations who have more than 20% of foreign funding, but in the same time, there are different layers. Putting the homophobic law banning of homosexuality in constitution, and then foreign agent law, and in addition to this, they're introducing the translation of US FARA law, which will be which include the criminal liability for being connected with the foreign agent organization, assuming that all advocacy we are doing, all human rights protection we are doing, it's political influence. They are making this assumption. Next slide. And together with this, we have LGBT propaganda law, and together with this, we have in Georgia, for example, a banning of participation of civil society in any actions. Next slide. And I guess that I need to say that it's not so heavy in your EU countries, but also we see very situation with shrinking space, and that work was done by Correlation European Harm Reduction Network with Right Reporter Foundation for Civil Society Forum on Drugs, which is also important to analyze not so severe shrinking space, but it exists. The next slide will show the key problems. And we will publish the presentation, and we'll all understand the challenges. And the next slide, I guess it will be already, we are trying to scream about all of this. And next slide with Lancet, but it doesn't help if there are no political will. And that's actually our communities, and you could find what we are trying to do in Eurasia to unite in protecting communities in this activism. I guess that's it. I hope that there are no next slides. No.
Thank you so much, Ganna. Thank you very much. I mean, it is troubling. It's troubling the fact that we've been fighting for so long to expand civil society space, and now we're facing threats left and right, and often quite oblique, right? So, you know, a little bit of losing of space here and a bit there, and then after a while, we're just completely stuck. We can't talk about harm reduction online anymore because it's propaganda or it's prohibited information. So I think we need to be very mindful of that and stand in solidarity with one another, with our sister movements as well, and make sure that we resist all of these really problematic moves from certain governments. Moving on now to our next speaker, and a bit of hope now in terms of how civil society has been able to engage constructively with local authorities to push the boundaries of civil society involvement, and how civil society can help shape programs and policies, in particular through an intersectional perspective. So I'm very happy to introduce Roig from Metzineres, based in Barcelona in Spain, who's going to share her experience.
Thank you so much for the invitation, and my panel. Yeah, when we are talking about Catalonia, we are talking from a really privileged space, because yeah, it's true that in the beginning of the late of the 80s, we began to have one of the higher prevalence of HIV and overdose deaths. And it's when the group EHRA, was a multidisciplinary group of researchers, which included people who use drugs, psychiatrists, politicians, anthropologists. They went to see what was going on in the rest of Europe and in the rest of the world, to see how they were managing all this. And they came back promoting a community-based interventions from a harm reduction perspective, and also indicating that this group of researchers and activists should be the ones guiding the Catalan policy, but not just the Catalan policy, it guided also the Spanish policy a little bit for a while. And it's true that since the 90s, the prevalence of drug users activists has been always present in Barcelona, especially, not in other parts of the state. The legal context is a really privileged one, because drug use is not penalized, it's not criminalized. It's criminalized, the drug use from vulnerable populations, because even if the drug use is not penalize most of the people that is in jail is because drug-related crimes anyway. They are also poor and part of marginalized communities. And the only thing that we have a little bit penalized in that sense is when you are using in the streets. Of course, selling drugs is illegal. But it gave us a lot of freedom from the civil society to develop harm reduction services. And I'm talking about Catalonia, different way than Spain, because in 1985, it's true that we have the first national plan on drugs, but in Spain, they focus more on prevention and treatment. In the meanwhile, in Catalonia, they decided more about a Catalan network of care, which included not just prevention but treatment, but also harm reduction, and also included a community-based perspective. It's not the state that is developing the services, but it's the community that develops the services that the state want to support for sure. Then this is why we have a lot of strategies of harm reduction beginning in 1986 with the first methadone program, we have needle exchange programs everywhere, cannabis associations. We have also, and one of the things that makes this really strong was that from the beginning was a political consensus just in Catalonia to not use harm reduction and drug policy as a political weapon between parties. It was a matter of health. Then this was the most important thing in that sense, and make more stable all the strategies of harm reduction there. No? This is why we could develop also the first drug check-ins, needle access programs in prisons, that we should see if they are working. It's not the case, but we have the first needle exchange machine in the street that is done just for peer workers in Reus, a really important initiative, and supervised injection rooms. I think that just in Barcelona we have around 13. These make go down the rates of HIV and Hep C. We don't see this go down of the overdose rates, we have to say that, but we do in the HIV and Hep C. Also, it's about how we are collecting the data about overdose rates, but whatever. Next slide, please. Anyway, we have all these services, but still, we find that there are a lot of population that they are not arriving to the services. We're going to focus on women and gender non-binary people. That is the one that we are accompanying in Barcelona. But what we found is like, okay, we developed a lot of different services related with drugs, but we know that the problems are not the drugs. The problems are the social inequality, the social injustice, poverty, mental health issues, housing, etc., etc. Then, because we were developing just these services toward drugs, we forgot all this intersectional perspective. Then now we have the people that is alive, which is super important, is crucial, and talking from places that they don't have services, of course, is crucial. But at the same time, we have a lot of people that live in a chronified situation of exclusion. People is living, but people is alive, but they are not living, they are surviving. No? And in the case of women who use drugs, they are not arriving to any network. They go to the network, the people who use drugs cannot go to any other network, not the mental health ones, not the housing ones, etc., etc. They get expelled. But at the same time, women cannot go either to the protection networks or anything because they are using drugs. Then we find a huge barrier for all the rest of the networks, and the services for people who use drugs are just focused on drugs. And what happened with all the rest of situation? Next slide, please. And this is because of stigma, not because women or people who use drugs cannot hold on their services. Next slide, please. Next one, please. And this is why in 2016 we created the network of women who use drugs, and from then in 2017 we began with Metzineres. We didn't ask for permit. And we were going from one organization to another, not access to grants, really limited resources. But anyway, the Catalan government recognized us as a part of the network, of the harm reduction network, the official drug consumption network also, etc. And in 2020, we become a cooperative. And in that sense, we also became a specialized intervention on violence against women. It was amazing. It's the first time that the harm reduction services is not pending from drugs, it's pending from feminist department, from the equality and feminist department. We have an equality and feminist department. That is also a privilege, I know. But at the same time, it means that it recognizes that the problems here are not the drugs, but the trauma and the violence. 2025, we are still struggling for the fundings. Next slide, please. And of course, when you take away the picture of the drugs, what you can see is all the complexity. But when we began, we thought that we will have around 40 women. 7 years later, we have like around 600. What means that is not that women are not there. That is that when you take away the drugs and you put the center the people that you are serving and not one of their problems, they arrive. And especially this is super important for women, that what they are looking is for safety, And I'm gonna run in the next slide. And I don't wanna go there because you can come and see that tomorrow if you want. Then next slide, but we are putting the person in the center, not the problems, trying to reduce the barriers to the rest of the networks of support. Next slide. And including the women in all the design, the implementation, the monitoring and the evaluation, not just of our action, but also taking part of the public policy. Like now we are part of the mental health plan for perinatal health, for example, as influencing the politics. Next slide, please. We also like to go to fight for rights in the streets, and last week, that we were having that. And next slide, please. This is because that from the beginning, one of the things that make us a little bit special was the way that we tried to monitor, because we were really serious about how to monitor the data, and we provide the better data that the state can provide. Not for nothing, because we are faster, we are in an open source resource, we can develop our own indicators that are important for the women. And next slide. And I am finishing. This is why we do this kind of materials. I don't want to go deep, but it's a way also to be able not just to influence the government, but how the laws and everything is impacting the community, and how we can make that accessible to the community. And next slide, and I am finishing here. Is I guess that this is why we have been recognized as a good practice, including here. And yeah, you can follow us. Next slide, please. You can follow us in the networks and take our material, please. Thank you.
Thank you, Aura, and I think this is a great example of how to expand a bit the concept of service provision for people in a situation of vulnerability, in particular women, and the fact that you have a feminist department is amazing, and that expanding this service is brilliant. So long may it last, and it can serve as a model to others as well. So now moving on to more institutional engagement with civil society. I've got the pleasure to welcome and introduce my long-standing colleague, Danilo Ballotta, from the EUDA, formerly known as the ENCDDA, so the European Union Drugs Agency. The EUDA has, as many of you probably know, renewed its mandate and adopted a new one last year, expanding its activities, but also for the first time trying to establish a mechanism for more systematic engagement with civil society, which of course we advocated for a very long time. So very happy to see that. And so we asked Danilo today to share a bit why they did that, why they took that direction, and where they're at in terms of establishing that mechanism. So Danilo, you've got the floor.
Thank you. Thank you, Maria. Sorry, my voice. 4 days of CND have already paid a toll of me. I have one left. So thank you for this invitation. Indeed, the UDA, as a boy of a young man of 30 years old now, because it was created in 1995. And 2 days ago, the legislator, the European Commission, the Parliament, decided that we should work with civil society. We have always worked with civil society, with NGOs, but on an ad hoc way, on project, on issues that we would find easy or better to have data from civil society. And but this regulation changed a bit the skin of the agency. Before we were a monitoring agency, just producing data, putting on data. Now the EU countries give us the task to produce recommendations, produce alerts, and produce data. And the philosophy of the agency is to produce data, alert, recommendation, to anticipate next challenges or the current challenges that we have in the EU. Before the regulation had one mention to civil society. This regulation, this new one, has 22 mentions. So really, civil society is everywhere. Basically, give us the mandate to exchange information, pull out knowledge from organization, and consult organization on our products. So what we are preparing and is already ready, we need to launch it probably after the summer, after we have some criteria, a digital platform in which all NGOs can apply. We are thinking to do something about open-ended, so there is no call, no space, no time. If you want to apply, you have, of course, we have to put some criteria of belonging. We are thinking to cluster organization into their area of work. We are thinking prison, prevention, security, treatment, etc., etc. So that will be for us easier when we want to consult, to have the right group to consult on a project or on a process we are doing. We are therefore working on a common definition because the regulation asks us to work with civil society organization, which is an undefined concept, but then it goes deeper into affected communities and people who use drugs. So these are the universe that we are interested to do. And we want to, through this digital platform, we want to create an ad hoc, a constant and systematic dialogue to produce and exchange data and publish data, to produce with civil society and exchange recommendation, and also to consult civil society on our projects, on our publication, on our processes. This is ongoing at the moment. Probably after the summer, we will start to see our own input. But something I want to say here today to you is that we do not have to wait for our mechanisms to be in place. We are open for business with civil society. So I challenge you to challenge the EU agency with ideas, with a project, with anything you like. I listen very carefully to Hannah about the shrinking space there. Is there anything we can do together? Is there any newsletter, any communication? Of course, there is a proviso here. Anything that is produced by the EU agency becomes official, and that's the EU agency stamp. So there are criteria, filters, validations, things like that that maybe you are not used to, but we do with our focal points. We don't publish the thing that comes to us. We receive, and then there is a navette of days or months to verify what we have to do. I would ask any organization that wants to work with us to enter into our mind, the universe, because we need to work in this way. We are very, very aware about the information out there and the importance of putting out there reliable information. So it's a strong thing for us and for you and for all of us together that we continue this. We continue the reputation and the respect that the agency has built in these 30 years to be a source of reliable information. So this must be maintained. But besides this, we do not have barriers. We do not have any censorship, and we do not have any preconception to work with the civil society. We have created, we are very small at the moment for this year. We have just a coordinator for civil society. So we are also in terms of budget, we are very limited, but this does not mean that we'll stay this way. My last point is because we have started consultation and it's about funding. I know that 50% of the asks, and I understand why, but money is survival for certain organization, is about money. At the moment, the agency does not foresee any mechanism to deliver directly money for survival. But this is not something that should not be addressed just because our rules do not allow at the moment to do that. So it's something important that we have to consider, probably not with us, but with our masters. But it's something that we need to put on the table because it's an important thing. Thank you very much for the space. Thank you.
Thank you so much. Thank you, because we've been working with the EUDA for a very long time, engaging very constructively with you, with your colleagues, and we really appreciate the support. We will take you on that offer of reaching out.
Yeah.
So you will hear from us soon. And yeah, on the funding, I think this is an important point. For a very long time, civil society felt really privileged every time we were called upon by policymakers to provide our inputs and recommendations. But obviously, we're doing this voluntarily for free for many, many, many years. But I think it's high time that the expertise of civil society is adequately recognized and it's funded. Because we all do what we can, but we also need to live. So I think it's very important, in particular for networks of people who use drugs, of people in recovery, people who are affected by drug policy. So hopefully some funding mechanisms will also become free and we'll be able to take advantage of these too. So moving on to our next panelist, Lucie, thank you so much for being here. So Lucie Laffont works with the European Commission. So the European Commission is at an interesting moment right now because the EU drug strategy is about to expire at the end of the year. It's going to be a new framework that will be developed. And so within that framework, we wanted to ask Lucie and the Commission, what were the plans in terms of adequately engaging civil society in the evaluation and the drafting of the new strategy. So thank you for being here.
Thank you. Thank you very much for inviting me to speak on behalf of the Commission. I'm very pleased to be here. Of course, the civil society has always been a very important stakeholder in formulating the policy at the EU level. You already explained what the Civil Society Forum on Drugs was. I think it's also a good example on how the Commission engages with civil society. It was renewed last year. Now it is composed of 43 organizations, out of which 13 are new members. And it also takes into account the gender and geographical balance with members from the EU member states, from Western Balkan candidate countries, and Turkey. The Civil Society Forum on Drugs aims to gather a high level of expertise to support the policy formulation and the implementation of the EU policies. And is a broad platform to have a structured dialogue between the Commission, the other EU institution, and the European civil society. It was already created in 2007, so it's been a long time that we are actually engaging with civil society in this framework. And it also operates in line with the EU drug strategy and action plan for the period of 2021-2025, which also recognizes the crucial importance of civil society in participating in the development, implementation, and evaluation of the drugs policy. So these two documents frame the one that I mentioned, the drug strategy and the action plan, frame the drug policy for the period of 2021-2025. And they take a balanced, evidence-based approach to address the drug phenomenon in Europe with the preservation of human rights at its core. And the strategy highlights as one of the priority areas to address the need to promote civil society participation and to ensure sustainable funding as well, which is also an important issue. And the action plan also includes concrete action to further strengthen the civil society participation and involvement in respect to the development, implementation, and evaluation of drug policies at member state, EU, and international levels. The involvement of civil society is of course key to make sure that we can work towards our goals to protect and promote public health and that we can offer a high level of security and well-being for the general public at the EU level, but also in international fora like the CSFD like this year. So the EU is obviously committed to involving the civil society in the current and future developments in the field of drug policy at the EU level. The civil society organizations were already involved in the evaluation of the previous EU strategy and action plan and contributed to the formulation of the current strategy and action plan. And as you mentioned, the strategy and action plan are expiring this year. So the Commission is carrying out an evaluation of the strategy and the action plan, which included an external evaluation carried out by an external contractor, and the Commission will draft an evaluation report on the basis of this external evaluation. And as part of the evaluation, the civil society was involved, notably with the organization of a workshop to collect information and evidence from the Civil Society Forum on Drugs. And also the Commission carried out a public consultation, which was published on the Commission website, where civil society, but all the stakeholders as well could contribute. And the information that we received through this public consultation are being taken into account as part of the evaluation. Also, one important point is that the plenary meeting of the Civil Society Forum on Drugs that took place in December last year, there was also a presentation of the evaluation process, and so the civil society could also contribute to it. And so obviously the finding of the evaluation will be used for the future strategic framework on drugs. It will be an important basis of the framework. It was already announced there would be a new action plan against drug trafficking in the political guideline of the new European Commission. But we will obviously keep the comprehensive approach as part of the strategic framework. We don't know exactly yet, we don't have an official announcement to make on the form that this will take, but in any case, we will keep the balanced and comprehensive approach of the current strategy and action plan. So yeah, I think that's what I wanted to mention today, and of course the discussion that we're having today are very important also in the development of the future strategic framework and action plan. Yeah. Thank you.
Thank you so much. Yeah, it's good to hear that we'll continue being engaged. And obviously, the previous strategy was probably the strongest that we've had so far in terms of the balanced approach with pillars on demand reduction, harm reduction, supply reduction, and international cooperation. We really hope that this balanced approach can continue going forward. The CSFD can continue being mentioned, and the broader role of civil society there. So thank you. So we have time for discussion. I know we're a small group, but at least we can have a nice chill down discussion now. And then we'll have Zaved who will provide some concluding remarks. I mean, just to say, it was very important for us to invite Zaved Mahmood from the OHCHR, the Office of the High Commissioner for Human Rights. His office has been really instrumental in supporting civil society in the discussion. The OHCHR has published a really, really important report in 2023 on the human rights implications of drug policy, where it includes very strong references to the need to ensure meaningful civil society engagement and the engagement of particularly affected communities in the discussions and in all areas of drug policy, so design, implementation, and evaluation. So Zaved will have the floor in a few minutes, but if anybody would like to share or ask questions.
Thank you. I'm Ivana Vujovic, coming from Juventus NGO from Montenegro, and we can talk about this topic for a very long period of time because it's affecting all of us. I have a few comments on Ganna's presentation. It was really interesting, and we have developments meantime from the last week. There is the law in Bosnia and Herzegovina, the part of Bosnia, Republika Srpska, where they already have a law on the foreign agent, although it's not mapped there, but it's clearly that the map is showing that which countries and which regions are the most affected, where we have Russian proxies, where we have Russian foreign influence, but now we have, of course, that alignment with also other pro-rights movements, and the alignment is very strong, and with that story we all know, but it's important to understand this is just moving forward. It's not going to stop. So, which is the reason why I would like to ask also to comment another thing and to ask a question. Also, if we would analyze, especially in our region, the implementation of the national strategies for drugs, we would see that maybe in some even countries, the most of the like the biggest part of the strategies are implemented by the civil society organizations, and now we have a war against the civil society organizations in the regions. So that would affect also the implementation of the EU strategy for drugs. And I don't know if there is those kind of data showing the proportion of the action plans and the strategy implemented by the by civil society organizations. So my question is, what is if European Commission and EUDA has any kind of strategy, ad hoc ones, how to reply to the crisis that we are in, because that crisis with the civil society organization is going to affect your work, and also the whole framework that both EUDA and also parts of European Commissions are working on, as you are also very much aligning on our support, and you know how the quality of the work that is produced by the civil society organizations, but we do not hear any reply, and we don't see any actions coming from the European Commission, and that is frightening, as this is what, for example, International Parenthood Plant Federation said, that organizations that have built the movement are now turning the back to the movement, feeling that we are just like there on the front line of the battle, but left alone. And it is absolutely unfair, and it's something that, in this case, I think European Commission has to take stakes and has to also show the responsibility. Is like we all of this group of people, if we don't have a job in this area, we can find much better paid jobs tomorrow, just to be aware. I think that we are all aware of it. Yeah. But we are here because of the mission. And we would like, and we are still here, and we are still fighting. And I would like to see that from the also organizations that were our allies up to now. That's my question to you.
Nice question.
Well, I don't think I can reply to all of your question. I think it's also a broader issue that not only concerns the drug policy fight, but all the areas as well. And I have to admit that personally, I don't know what the commission, but I will take it back and obviously report back on this, because it's a very important point. You also asked about if we have any information on the proportion of the action that are implemented by the society organization in the strategy. I don't think we do. Maybe Danilo, you know, but I mean, it will be part of the evaluation and just focus on which actions are being implemented by the NGOs. But I don't think we really have this overview of how much of the strategy, but it's interesting for this. Unfortunately,
I can start from this. I don't think we have a specific question how much is. We could have an estimation, because we know that many of the services we report of are in the hands of NGOs. With drug checking, harm reduction in many countries are just on the base of NGOs, otherwise they would not be done. But we do not question that, we do not ask in that way, so nobody answers in that way. On your question, I was reflecting why we don't do something with the instruments that we have as an agency, commission. I would even put the civil society unit of EUDA, because they have a role to play, and the society, the organization of specific region, with an angle, with some data, knowing that this can annoy someone, so we should be very careful how, I can't do that. I need to take care about what is our footprint that we leave, because we would not be attacked on a return on the basis of, these are allegations or these are, so it's good when you are there with our data, that then you can stop any sort of coming back. And you don't want to be attacked more. You want to be solid. I open here. Let's you take the lead. Let's see if there is anything, at least as investigating the possibility of doing something. We can tell you certainly, yeah, we can give you also an idea. There are certain things we might not want to do or can do, but others certainly can do. Let's look into it.
Yeah, I would like to say something, not like the EU presidency, but like the person from Poland, that if somebody delegalize NGOs in Poland, the system concerning the drug demand will be collapsed. Because 100% harm reduction is the hand of the NGOs. Most of the prevention activities are in the hand of the NGOs. Rough estimation, but I think around half, even more, treatment, outpatient, inpatient treatment centers. We have 83 inpatient treatment centers are in the hands of the NGOs. Only expect post-rehabilitation or fully the NGOs. Only OST, mostly are the public institutions, but also few NGOs provide this. Yeah, that we are fully dependent to the NGOs in Poland. Yeah, that's. Even we have some conservative governments, a few years ago, my institutions didn't stop to give the money for harm reduction, prevention. We have some challenging, of course, but it was any cutting found that right-orientated government will not give money to the left-oriented organization. And my private opinion is that the role of civil society forum generally is bigger and bigger. We have some problem with Ganna show us, but generally you, like the organization umbrella, you are much stronger in this current drug strategy. Now that Danilo have the new job, yeah, and headache, how to use this opportunity, yeah, because Danilo talking about the monitoring. I'm also from monitoring, but 17 years ago we started to organize annual harm reduction conferences because of the monitoring. And after 8 years, we go to talk about response, effectiveness, harm reduction, to give the platform to exchange idea between NGOs to make harm reduction. And it will be the same in EUDA. Yeah, then we start with monitoring, but for sure, then we use your potency to think about response, how to build effective system, what should be this role. Yeah, it will be this, that one side is pessimistic, yeah. But generally on this political level, yeah, that your representation, your voice is stronger and stronger. And also, I hope more taking into account, yeah, that I don't see any risk, at least by us. Yeah, because of the lobbying, you are more strong in EUDA. Yeah, it's the big changing, yeah, Danilo. Absolutely. You never expect 8 years ago that you would be coordinator to have the new job, yeah, with us.
You say that as a good thing.
No, but I think it's also reach out to the CSFD, because we can then transfer that information to the Commission and the Horizontal Drugs Group, which is the group of member states within, like, across the EU that meets every month to talk about drugs. Like, whenever there are issues like this, like even when it's outside of the EU, but the EU has a diplomatic role in helping to manage the situation, then we can transfer that message with as detailed information as possible and key points of action that would really be helpful. But that's something that we can do. So reach out to Ganna, reach out to Stig Erik's also part of the core group. And so Stig Erik, you wanted to take the floor.
Yes, it's disturbing to hear Anna's description, but I also want to share, my experience from Norway. I sit here with a red badge. And this is because civil society is regarded as an integral part of the political system. And it's been like this for 150, 200 years. We've been identifying needs, developing services that may or may not later have been taken over by the state. We are always asked for advice and consultations. I mean, they don't always listen to us. I can sit with the Norwegian delegation in their morning meetings. They ask me for advice. They ask me for input. We are regarded as colleagues. And of course, they have their mandate, but they are interested in hearing what I pick up from my contacts. And so, I mean, it's sad to hear that civil society is seen as a threat rather than as a resource and as a collaborating partner. But I also think that we touched on the issue of funding. If you want grassroots organizations, if you want independent civil society organizations, then you need to fund, need stable funding. Otherwise, we're not money-making organizations. We are so what are our sources of income? And there's of course the risk that industry will buy civil society spokespeople or whatever sort of funding that we can get. It's if we want the independent NGOs, there needs to be some basic funding. Otherwise, it's a very shaky concept, I think. So I just wanted to share that because there is a different way than regarding civil society as a threat. So,
thank you. Okay, two interventions. I think they will be the last ones. Then I'll go back to the panel very briefly and give the floor to Zaved.
5:30 have to go.
Oh yeah, so sorry. So we do have to give the floor to Zaved before the panel maybe says a few words. Poor Zaved is actually missing his dialogue with civil society. So you guys
Crucified if I don't go there.
okay, so Nick, do you want to start?
Similar situation in Canada where on civil society, there's no Canadian politicians here, right? Or I'm going to speak as Nick, civil society. I think you also we have to just be careful that you're not used as a rubber stamp. I can tell you right now that some of the stuff that Canada's putting out, the side events, was not supported by civil society, but they can sort of say, oh, we consulted civil society. So just very cautious about that. Yeah.
Right.
Yep. Okay. I'm Artur Malczewski. I represent here the Drug Policy Network of Southeast Europe, being to civil society organizations for many years, but currently working for the enemy. I'm caring for the city of Athens, from the municipality of Athens, as a drug policy expert. Now, I'll be really short. First of all, thank everyone for your presentations. When I joined the Civil Society Forum on Drugs back of 2019, representing the European AIDS Treatment Group, probably the biggest HIV organization in Europe, I was quite amazed, and I learned a lot of things the hard way about shaping drug policies and how to write an action plan. And it was really amazing, all the journey. I resigned because of contradiction in terms, because now I represent a local government. But I always have this kind of, that was the good news. The bad news was the following. We were a diverse group of people and different organizations representing civil society from many different parts of Europe. And there are some specific but how can I say, problems in each region that I think they're not equally addressed. For example, where I come from, Athens, Greece, there are huge developments regarding harm reduction and public health and everything. Yes, that's the good news. The bad news is that there is an overdose ongoing crisis, a huge mortality of people who use drugs, proven by epidemiologists, by top-leading epidemiologists, and also a marginalization of civil society organizations. Not to say that this is intentional. It's kind of a structural element of the Greek society to be really suspicious towards civil society organizations. And I just want to say that probably the Forum and European Commission must observe and trace this kind of local things and to, just to address them in a way. That's my, my short intervention. I'm kind of more liberated now because I don't represent the APG anymore, so I can be really aggressive with the commission. I'm just kidding.
Thank you, Mario. So let's give the floor to Zaved so that he can go through the dialogue, and then we'll have a chance for the panel to come back to on a few of these questions.
Thank you very much for all of your presentation. However, I would like to start with the apology to Marie particularly and few other colleagues. Yesterday, there was one meeting organized by UN Talks team, but there was no chance for the civil society to engage. And that was not acceptable that I passed that message to the UN Talks team, UNDC colleague that one, so that I take this opportunity to apologize publicly. Already, I think that importance of the participation of the civil society has been discussed by our presenter here, Artur, Lucie, and Danilo. It explained that why it is important, the participation of the civil society. And also, I would like to add people who use drugs, the community, that also part of the civil society we need to consider. And from our human rights perspective, we consider all of you as human rights defenders. That we have to recognize that, because why I'm saying that when we are talking about human rights defender, then within the UN system, we have UN Declaration for Human Rights Defender, which provide protection framework. So let's discuss about this one, because you are working to protecting right to health or promoting right to health of people, or even life, right to life of the people. Whether harm reduction, it saves lives, it prevents overdose. So you are actually civil society or human rights defender. Let's give that framework and recognize that. There is one issue I would like to take away that perspective. Aura mentioned that linkages between different other part of the civil society. You are working with the feminist group. It is so important that engaging with that. We have seen that. I'm happy to see that more human rights civil society is engaging with the drug policy world now. 10 years back, it was not like that. It was very different world, drug civil society and human rights and others working differently. I'm so really happy to see that more connection. It is really needed to connecting to the different part of the civil society. This year, I saw that large number of indigenous people, civil society, including from the European region, from Denmark and from Norway, Finland, indigenous people, civil society was present here. So it is really important that we need to connect with this issue. In several events, I raised this issue, funding crisis. It is really important that, yes, as we mentioned, Danilo, just we have to go back to our masters, mainly state government, and to try to convince them. It is really important that continue to supporting civil society. We have seen what happening at the COW. There's all this discussion going on and shrinking civil society space, not only in this space, also in Geneva and other places we are seeing. So we need to, and when we are talking about just discussing with the master, I think that there is a big movement and campaign from the citizen. It is important. Civil society means we are talking about citizens. Citizen campaign to move forward this one. And also I would like to again repeat one, our Deputy High Commissioner mentioned at the Human Rights Council, cutting funding means cutting people future. In the future, it is not only the simple thing, cutting funding, it is future. As you mentioned, one colleague from Norway, that funding their independence. It is really important also that point that mentioned by colleague, independence of the civil society is really critical. I have seen in this platform that a lot of Congos, government organized NGOs floating around here. So they are not independent, they are coming as a mouthpiece as civil society. But from human rights perspective, we really think that it's important how to ensure independence of the civil society. With this note, again, thank you for everyone. And it has been really exciting 4 days. And one thing I told many events, and I would like to repeat again, every morning we are getting up with drip by drip disturbing news. It's like poison. But let's take a stand that we will fight back. Thank you.
Thank you, Zaved.
But you go, you did as well.
Thanks, Zaved. I mean, yeah, we'll let you go.
Yeah.
Please run. Have a good half hour of dialogue. But thanks so much for staying until the end. And just if I can give the floor to our panelists for maybe 1 minute each, just so that I want to make sure that you have this time to react, and then we'll close the panel if you guys have 5 minutes to spare. So, Aura, do you want to start? Okay. Let's start if there is anything you'd like to raise.
Yeah, thank you. No, I think that connecting what he was saying, no, is like how important is like as a civil society and being in the front line is where we have the information, where we have the knowledge, and it's the only way that we can inform, have really informed drug policy, no? Because finally there is a lot of invisibility in our work. And also we can provide with really updated data, but also interesting data. I'm more worried about the indicators than not about the data collection. What are the questions that we are asking? Because I am really worried about all this process with the EUDA also, of how we can manage not just to be a monitoring tool, especially, and how we're gonna also regulate who gonna be able to access to these monitoring tools, because as a small organization, it's really difficult also to be in that standards, but at the same time, we are the only ones doing the work that we are doing. Then in this regulation, just take care of them, let us behind.
Thanks, Aura. And I think it's really important to think about, yeah, are we asking the right questions? So remember the last time around when we were consulted to evaluate the previous EU drug strategy, the questions just couldn't reflect anything that we wanted to bring to the table. And it was very, very frustrated. And we had asked for the next round of evaluation to be involved in the shaping of the indicators of the questions that we asked, because we need to ask the right questions to give the right answers. Ganna.
Yeah, for me, it's important for us to understand that we always, as a civil society, we're complaining. But right now, I understand that the golden era for community participation and civil society participation could be maybe we just passed it. Not to mention that was the golden era. and like for our region, that's for sure. And it's becoming worse and worse. And this crisis could really kill us. Like we are cutting stuff now. And the same with the national organization have no staff for advocacy at all for at least 2 or 3 years for sure. And that's actually something which will transform the place. And thank you very much for your participation. And the point is that narrative is now that it seems like no adult in the room, and anti-gender, anti-human rights language narrative becoming mainstreaming. And that's why we are all, and honestly, despite all the challenges and the views on drug policy and views on the European future, our democracy is very fragile. We thought, and somebody could challenge it from right, from left, but the point is that it's so fragile and this order is so small that we need to be cautious about our alliances, new allies. Understanding that we are all now feminists, we are all now speaking gender, we are all now human rights activists, democracy activists, and we are all campaigning for the citizenship rights. So that's something which we are in the new world already. And from this perspective, of course, the sustainable funding for demand reduction from EU could help a lot, and health funding from EU on the regional level, on the national level, and funding of this part of the drug strategy, EU drug strategy, not only supply reduction, but this big part of demand reduction, harm reduction, that's crucial. If we're not funding, then we will have only a lot of police forces and money spent to this, and it's good, okay, but it's not changing the real situation of the life of people. That's what I believe.
I'm going to turn to Artur.
Yeah, just one point, because I fully agree about the financial issue. that NGOs should have the sustainability financial. What in Poland, when I'm hearing you, they have quite good situation because in our system is the central budget, which is from my institutions, give the money, but also every local communities have the money from alcohol drug prevention. And even some crazy government cut budget, they will have applied for the local communities money, and Warsaw City has more money than my institutions and spend quite a lot for climate action too. It is one of the crucial to have the money, but also not only from one sources. Like now, if somebody have most the money from US aid, it's out of the business. Yeah, it cannot be dependent on one dollar. But it's an important issue. Just
Yeah, we have a lot to do. We have a lot to do. We need to start doing things. I imagine an agency in 5 years in which civil society is a full-fledged partner, and we have common publications, we have common products, we run projects. So yeah, I see that. I see this agency that would be between, as always be, between the professional and the government. And as you said before, we started with money, we started with data, something that in '93 they let us do data because there was the most uncontroversial things. Those controversies were at the time the same that today, but nothing has changed. So do data, everybody's happy. Countries that were fighting, Sweden and Netherlands were fighting like crazy in the European Parliament about prohibition. So the agency had no policy thing, we did not have policy. After 30 years, we influence policy, not doing it, not wanting to do that, we do. And we'll be the same thing without, recommendation or legalization. That's a no-go for an agency. If we start with the data, if we start with the evidence, if we work on that, you are much more dangerous than if you go back.
Yeah, our